You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Hello, everyone. We're back at Stellar Success Podcast. I'm your host, Dr. Tudor Francu, and I have an interesting guest today, Dr. Stephen Waldren, all the way from Kansas City. How are you, Doc?
I'm doing well today. Good to see you.
Thanks for coming over. I want to look into your journey a little bit and see if you can give us a little overview of, where you started and where are you now?
Yeah. I think it kind of boils down to kind of passion, a little bit of luck, and some great mentors is kind of how I got to where I'm at today. So kind of the mentor to start with. Let me start with the luck. So when I was in medical school, I wanted to be a surgeon when I started. And then my first rotation was surgery, and it's like, yep, that's not for me. But I had a great primary care doc that helped me. I had a golfing accident with my brother, actually, and lost a spleen as a kid. So the primary care doc was kind of always there, kind of helping and stuff like that. So I was like, all right, I want to be a family physician. So that's the route I went. And for some reason, in my fourth year of medical school, I decided I should take an elective in the NICU. And why I thought I needed to be in the neonatal ICU is beside me, because I didn't want to deliver babies. So I'm not sure why I decided to do that. But luck had it, there was a pediatric resident there that was planning to do a fellowship in medical informatics and neonatology at the University of Missouri, I was at the University of Kansas, so it was just across the border there. And I was like, oh, I have this passion for kind of the technology and stuff, but I didn't know that was actually a career that you could do. It was still so early in that career. So I said, all right, well, I'll stash that away. I did another kind of rotation with the IT department and created a rounds report and really started to see how the technology could really help me as a physician.
What year was this?
So that would have been probably 1998. So it was my third year into my third year of medical school. I graduated from University of Kansas in 1999. And then I went to Wesley in Wichita, Kansas to do my family medicine residency, which was a 3-year rotation. And again, found a great mentor there. Dr. Boyce was one of the faculty members there. And she seemed to be the happiest family doc in the whole faculty. And I was like, why is that? And she had a professional hobby. And it was testifying in child abuse cases and stuff like that. And I was like, well, if that's a professional hobby and she's the happiest, I got to find me a professional hobby. So I set out to do informatics 30% time and family medicine 70% time. But I knew if I went out into practice, not that I would get stuck there, but I would not probably want to leave and go do a fellowship. So I decided to do a fellowship right out of residency. So it was through the national. Yeah, go ahead.
Yeah, I'm asking you about the timeline of this because 1998, the IT domain in medicine was like in the infancy.
Yeah.
I don't even think we had powerful internet at that time. It was probably like a little dial-up, if I remember correctly, right?
Yeah, it was dial-up, and then we had a T1 at the residency, and two of us were gamers. So when one of us was on call, sometimes we would come up and use the computers in the residency that were to do a little bit of gaming. I'm probably writing myself out because I don't think anybody knew except me and the other person, so I won't mention his name. But
yeah, interesting. So how do you remember informatics in the year 2000?
Yeah, so I mean, there was a lot of conversation around the Y2K potential bugs and stuff like that. So there was, some conversations there. when I was a medical student, there was Meditech. So hospital systems were kind of in place. And informatics itself goes way back, even into the 70s. There was, some decision support tools like Myson and others. So it wasn't necessarily new, but it was really a niche and really not a lot of folks. But
Yeah.
just growing up with my father, we were just super interested in electronics and building computers and doing those things. So I kind of caught that bug. And then when I saw with Meditech, I could actually not have to show up at 5:30 in the morning. I could show up at 6:15, print off the rounds reports. I knew what all the I's and O's were, what the labs were, what orders had been ordered but hadn't been fulfilled yet. So I knew all that stuff, and the nursing notes were all there. And so I had one sheet of paper for every patient that I was rounding on. So it cut my opportunity to round like in half the time. And then when the faculty would ask me a question as a medical student, it's like I always end up having the answers not because I was smart, but because it was on that sheet of paper. And that's again kind of when I got really hooked on informatics as a potential opportunity.
Nice. So what are you now?
So right now I work for the American Academy of Family Physicians. So we're a membership organization of family docs. I've been there for almost 20 years leading their health IT kind of efforts. And more recently started to help with some of the administrative burden issues. And lastly, of course, AI, since it's going to be a paradigm shift for all of medicine, but definitely I think for primary care and hopefully in a positive way.
Yeah, let's talk a little bit about this because I think this is a big subject that everyone is kind of scared of.
Yeah.
What is your view of how AI can help or cannot help?
Yeah, so I put it into kind of intrinsic issues of AI and then kind of extrinsic, which is the healthcare system. So unfortunately, the healthcare system hasn't changed much since we implemented EHRs. So there's the potential of, and EHRs from a physician standpoint have been not a success. Almost every doc complains about their EMR. Now, nobody wants to go back to paper. Let's be completely frank there, but it really hasn't helped them take care of their patients. It's more been for billing and documentation. So there's an opportunity that AI will be usurped by administrators, policymakers, and others, and saying, well, this is the AI that physicians should need to use. But if physicians and other clinicians step up and say, this is what we need and how we need it and what works, I think there's great potential for AI. We're already seeing that in the administrative burden space. So with the AAP, we had been looking at kind of these documentation assistants, and we saw a 70% reduction in documentation time. And this was before the ambient technology, which now is almost magical. You just push a button on your phone and it listens to your conversation with the patient. And when you're done, within 30 seconds, you have a note, and requires minimal kind of editing of that. And then we're starting to see AI assistants that can summarize the chart and create you a problem-oriented summary. It's like, oh, well, this is exactly what I needed. And then some exciting new, very, very new around kind of the EHR inbox and being able to manage that, which has been more of a challenge for primary care physicians. And I think all physicians since the COVID pandemic. Patients got access to patient portals and messages, and it's like, well, this is nice. I can just send a message to my doc. I don't have to wait on call, go through a phone tree, and then be on hold for 20 minutes, and then they leave a message, and then maybe they call me back that day or the next day. I can just send a message. So we see this explosion of that inbox.
Yeah, it's amazing. I mean, this whole, if you look back 25 years, in this time, it was an exponential increase in the availability of information, first of all. But also, it was something strange happening. The appearance of Dr. Google, that everybody seems to consult every day. And my question to you is Dr. Google going to be worried about Dr. AI right now coming up in force. And, what is the medical community going to think about how we can stop that? Because apparently there is an issue with patients consulting, the internet services and, AI and asking questions and asking Siri and asking this and that, Alexa and all this stuff about their medical problems and kind of diagnose themselves from the internet sources. How can we structure this?
Yeah. So I think a couple of things. So one, I think that, the cat's out of the bag, so to speak. They're going to use it no matter what kind of restrictions are kind of put in place. I think the main thing is moving away from generic kind of large language models, just generic AI tools that are meant to help with kind of anything, and then somebody trying to use that for healthcare. And it's right, well over 90% of the time, but that's not high enough. It needs to be, Six Sigma type of, reliability in these solutions. And there's not generative AI that's that good yet. But, we're seeing advancements every 6 months and at least doubling the power of it. So it's going to be coming. I think the real challenge is how do you do it from some type of entity that's providing this that has some liability and responsibility and accountability for providing medical advice. So is that something like Mayo that would lever an AI solution and maintain that and verify that that's correct and do all the testing that needs to be done? Or is that Google and they say, well, we're going to be held accountable for right answers? The other thing is being able to put the patient context into that. So how do they get the patient's record and information so that they can actually provide patient-specific kind of recommendations and guidance, as opposed to just general guidance that may not be pertinent for that particular patient. And I think those are two important things. And then I think the third is then how do you tie that back to wherever your usual source of care is and do that in a way that doesn't add burden, but actually supports. So having almost kind of two faces for that AI. One's the patient facing and one is the physician facing. So the physician facing one provides you the articles and summarization of the articles and the evidence and why it made its recommendation. So if you disagree with it, you can kind of look and see like, well, am I the one that's wrong or is the AI wrong? You're going to have to provide that type of assistance, I think, as well.
I see. I want to circle back a little bit into your personal journey and try to discover and kind of deconstruct your approach to your personal success. And can you tell us, is there any habit or routine that you encounter every day in your personal life to get you where you are?
Are you a busy medical professional striving to excel in life and work? Stellar Success Podcast brings you the habits and insights of top leaders in medicine and beyond. Discover strategies for balance, growth, and fulfillment in every episode. Follow us on Instagram at Stellar Success Podcast for daily inspiration. Start your journey to success today. Subscribe to the YouTube channel now.
Yeah, that's a great question. I'm a pro. Oh, sometimes I have problems with particular words, and I can see the word, I can tell you, describe it, but to say the word, I can't say it the way. But I procrastinate. That's the word I was trying to find. I'm a procrastinator. So getting up in the morning and first thing saying, okay, these are the tasks that I need to do, and just get on them first thing in the morning and have a routine like, this is when I check, I'm going to check email. First thing I get up, check Teams. I'm going to look at the latest news feeds that I have, which right now is focused around AI. Then I do that kind of up front and make sure that's done quickly. Otherwise, I'll say like, oh, well, I can just do that. And then you end up getting a to-do list that's, 20, 30, 40, 50 items long, which is a challenge. And then I think the other thing I try to do too is saying like, is this really important? Will this really move the needle on the objectives that I have or the goals that I have? And if it doesn't, then maybe this is something that I shouldn't be focusing my time on. And then the last thing is I try to break up my day. I had an attending or not attending, I had a boss that would get up at 5:30 his time, which was 4:30 my time. And then he would take a nap about 2 o'clock or whatever. So I knew like, all right, I get up early and I had no problem. I'd still been just out of residency. So getting up early was not a problem. So I get up early and I'd work. And then when he went and did his siesta, then I like, all right, well, I'm going to go do some of my personal activities and stuff and, just decompress from, all the decision making and the, the work, either just go mow the lawn or go do something. And I think that was also helpful too, to kind of break it up a little bit and have that kind of work-life integration as opposed to, thinking about it as work-life balance. Because my wife would say, I don't know that I necessarily have the balance, but I've done the good job of kind of integrating the work. So.
Yeah, it's funny how we think we have balances in our life, and then we have someone close to us, like your spouse or a friend, and who's like, "No, dude, you're obsessed with whatever you're doing."
And I think having that obsession or that passion is something that makes success a little easier. I think
exactly
work so much at it because you feel like it's fun to do.
Right. Tell us a little bit about anything that didn't go right in your life and anything, setbacks, failures, something that you really learned from.
Yeah, I think one thing, so when I did my National Library of Medicine postdoctoral fellowship, I did not keep up my clinical time. There was a challenge with kind of insurance. I had not had any claims, but they wouldn't do individual claims in Missouri for some reason. So once I let that lapse for just a little bit, it was hard to get back into it, and I never did. And I think that's one thing that would have been probably good for me to do is kind of maintain that 1 foot in the clinical space.
Yeah.
I always made sure to surround myself during my work at the AAP with our members that were in clinical practice, to validate my thoughts and my ideas and understand kind of what the experience really was. But that's one thing that I think if I went back and did my life one more time, I think I would have forced myself to find some way to maintain that clinical relationship.
Yeah.
I think it's important, and it's one thing that I miss because it's a nice fallback. It's like, oh, if you don't like what you're doing, I can just go back and be a family doc. That's not a bad.
Right. I see. Now, speaking of financial success, a lot of docs are having this issue because they're burned out and they cannot retire at some point. And do you have any specific strategies you have personally that can assure that you're going to be okay if you want to retire, when you want to retire?
Yeah, one thing that we did, my wife and I, and it was more my wife than I, so I don't want to take credit for this, but we ended up being very frugal in the first many years, and just paid down our student debt, our house debt, everything like that, and became debt free, which then kind of gave us an opportunity to say like, okay, well, we don't have to worry about maintaining a high mortgage and those type of things. So that gave us some financial freedom, and then also gave us then some opportunity to put more money away for our retirement. So I would say those are some of the things that we did to try to be financially solvent and then successful.
Are you thinking about any kind of other streams of income other than your income, regular income? Do you have anything that's coming in at this point?
Yeah, so I do participate in some of the kind of consultant things where you can put in, say, these are my expertise and stuff like that. And definitely since we've been doing some stuff, I've been doing some stuff in the AI space. I've been getting a fair number of requests. a lot of them are wanting, folks that are actually implementing the solution because they want to know like what's the ROI and those type of things. But really that's the only kind of supplemental, income. I did try to do a startup with a couple of colleagues of mine in probably 2007, right before the recession. We ended up doing quite well financially because we were doing federal contracts and coming in, a lot less than the big design firms, but we were able to then provide them more value at a shorter period of time because we were a more nimble company at the time. But we just didn't want to continue doing consulting. We wanted to do something with software, something where you have a recurring revenue without having to maintain a consulting firm. It just didn't make sense for us to continue to do that type of work, although we were making money doing that.
Interesting. So let me ask you something kind of introspective. With whatever you know by now and your experience and your wisdom and your life journey, if you would look back to yourself when you started this whole thing, what kind of advice would you give?
Buy Bitcoin? No.
That's a good one too.
Yeah. Well, I think I would have said, trust your instinct. So since a kid, like I said, when I had the splenectomy, issue, from that on, I was like, when my parents would say, like, what do you want to be? It was always a physician. There was no hesitation of that. And when I was through high school, college, like that, I would just tell myself to kind of open your aperture a little bit more, because, I think I was a good doc, but I think I was great at doing this informatics work and maybe doing more of a computer science in background with healthcare being less, might have been something that would have been allowed me to be more successful. I don't know, but that's the only thing I would say is like, definitely follow your passion, because you have to, I feel like you just have to do that, or you feel like you're having to go to work every day, as opposed to I'm getting up to do the things that I want to do and make the impact that I want. But I think I should have had my aperture open a little bit wider, and seen the writing on the wall, like with the .com and all those type of things that sure would have been nice to have some programming and that type of experience a little bit earlier. I think there's some opportunities there that were missed because I didn't have that expertise and experience, in my younger career.
Yeah. What's new for you this year? What are you looking for? What are your goals? What's exciting?
Yeah, so I want to try to make sure that there is a good direction forward for primary care, and really starting to try to fix some of the challenges on administrative burden. So I'm trying to evaluate all these different types of AI solutions in practice and really hear the voice of the physician and saying, is this really something that works? And if it does, why does it work? What's the feature set? What's the characteristics of the practice? What's the implementation look like? What was the ROI needed? Those type of things. And then to be able to disseminate that information out to all of primary care, because they don't even have time. A lot of docs don't even have time to shop. So it's one thing to say like, oh, I don't have time to implement something, but some of them don't even have time to go out and kind of look and see what's in the marketplace that could help them. So I really want to be able to put that forward. I've had some kind of medical issues that have cropped up in August that's really put a finer point on making sure that, I have a good, legacy kind of moving forward. And I think, I've done a pretty decent job, although I wouldn't say EMRs are a great legacy, but I think making sure that we've digitized healthcare so that we can actually now take advantage of some of these AI solutions is a good thing. But it's really the AI solutions, I think, that are going to actually make the lives of family physicians and other primary care docs better. And that's what I really want to focus on in 2025 and 2026.
That's great. Yeah, that's a great goal. Like Waldren, thank you so much for being here. How can somebody get in touch with you, see your work, look for advice?
Yeah, so you can connect with me on LinkedIn. Probably the easiest way to do that, especially if you're a new resident or medical student thinking about career in informatics. that's always fun for me to have those conversations with those young individuals and help them at least per se, like these are your options, and here's some pros and cons, and kind of what you might be able to do or not, and then let me know what you want to decide, and I'll try to find you somebody that is doing that currently in my network and get you connected. And I've been able to do that several times, and that's pretty rewarding and fun, because then they come back and say like, oh, I met with Steve Lynn at Stanford, and he just a great guy, and he just helped me, and they have these opportunities now that they didn't have before, and I think that's just great.
That's awesome. Thank you so much for being here, and I wish you good luck, and hopefully everybody's gonna keep up with this new trend.
Yeah, it's gonna be difficult to keep up, but I appreciate the time today, and great to be on the podcast with you today.
Thank you.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.